Good afternoon, ladies and gentlemen. Thank you for coming. Can I introduce Dr Duncan McCormack, who is consultant in public health with NHS Lothian, and as many of you will know, because you will have spoken to him over the last day or so, has been chairing NHS Lothian's incident management team, which was convened on Sunday, and Harry Burns, Chief Medical Officer, who I know is known to all of you. I'm going to run through various pieces of information and would ask you to bear with me. We'll then take questions and answer the questions between us as is most appropriate. If I can start with a very brief history of the Legionnaires outbreak that we're dealing with in Lothian right now. The first case was confirmed by NHS Lothian on Thursday, the 31st of May, that's last Thursday. The second case was confirmed on Saturday, the 2nd of June. I should say at this stage that those two cases did not necessarily signify an outbreak. Just for some background, there are in any given year in Scotland some 35 to 40 cases of Legionnaires' disease identified. Round about half of them are thought to be contracted overseas by people who've been travelling. What those cases, though, in such a short timescale did was cause NHS Lothian to establish its problem assessment group, which, when a further two cases were confirmed on Sunday, led to the formation of the incident management team, which Duncan has been chairing and which has been leading the activities and the efforts over that period. I took the decision yesterday evening to activate the Scottish Government Resilience Room. I should say at this stage it's not routine practice for SCOR to be activated as a result of a public health outbreak within one health board area. The normal course of dealing with that would be, as did happen in NHS Lothian, through the incident management team. NHS Lothian have been taking all appropriate steps through the IMT. What triggers SCOR to be activated is if the scale or the complexity of an outbreak leads to the conclusion that it's not appropriate for the response to be led simply by a health board in one area. And yesterday evening, the spike, quite significant spike in cases that we saw over the course of yesterday, the issues that potentially raises around NHS Lothian's capacity to deal with these cases, for example, in terms of critical care, and the potential for NHS Lothian to have to look for assistance from other health boards, led, in my judgment, to the conditions being right for the activation of the Resilience Room. SCOR, the Resilience Committee, met this morning and will meet again later this evening. Let me just give you the up-to-date case numbers now. The incident management team has just met. It convened at 2 o'clock. The latest numbers are as follows. There are 21 confirmed cases and 19 suspected cases. Of the confirmed cases, 2 have been discharged from hospital already, and as we know, very sadly, one of the confirmed cases died yesterday. Of the total number of cases at the moment, there are 12 being treated in intensive care, and the rest of the cases will either be receiving treatment in general hospital wards or receiving treatment in the community. So a very quick glance, you will have noticed that the numbers of cases have gone up since yesterday by 8, but the numbers in intensive care at this stage are slightly down on where they were last night. Obviously, as both Duncan and I have indicated already this morning, we would expect to see more cases over the next few days. I'll come on in a second to some of the action that has been taken and is underway. But given the incubation period for Legionnaires' disease, we would expect to see further cases emerge over the next few days, but we'll obviously keep you updated on that as the information becomes available. Let me now just briefly touch on what is done around establishing the case histories and looking at the patterns that exist between cases. The process of information gathering from the confirmed and suspected cases is ongoing. As you would appreciate, that's a complex process because it involves, in many cases, dealing with critically ill patients. NHS Lothian have brought additional public health staff to bear to make sure that the work around gathering as much information about the behaviours and the patterns and the recent histories of these patients is being gathered. But what we can say, and what has already been said, is that no link has been identified between these patients other than a general association with the affected area in the southwest of Edinburgh. Now, what that does is underline the view that the source of this infection is an outdoor community source and not an indoor specific source, such as would be the case if it was a spa in a hotel. And that points, as we have been saying, very firmly to cooling towers in the southwest of Edinburgh. Now, the work around the cooling towers is not led by NHS Lothian, it's led by Edinburgh City Council and the Health and Safety Executive, but both of those agencies are full partners in the incident management team and, of course, in the Resilience Committee. Samples have been taken from all of those towers, and as we have already indicated, all of them have been subject to what's called shock treatment, which is effectively chemical treatment to deal with the risk of ongoing infection, and there will be sampling over the course of today as well on an ongoing basis around these towers. Now, I say a word now just about identification of the source. First thing I should say is that I'm advised by the experts that very often with Legionnaires' disease, it's not possible to identify a particular source beyond reasonable doubt. So often what is dealt with is a balance of probabilities of where the source is likely to be. The process of identifying the source is a complicated one, and there are three main strands to that. Firstly, epidemiological, which is looking at the pattern of cases to try to narrow down to as small an area of possible infection as possible. Secondly, microbiological, that's about taking samples, looking at whether Legionella is in existence in a tower and whether it matches the particular strain of Legionnaires that the patients have. And thirdly, it involves the Health and Safety Executive inspection processes, looking at the management processes around these towers and, if necessary and appropriate, carrying out physical inspections of the towers. And that process, all aspects of those processes are ongoing, and we will keep you fully informed of the outcome of these processes as it becomes available. The last point I want to touch on before answering your questions is around public messages and public information. The general message to the public is that for the general population, the risk is low. As with many conditions, those with underlying health conditions, those in particular risk categories, are at higher risk. However, these towers have been subject to the chemical shock treatment that I've spoken about. It's also important to stress that Legionnaires' disease is not contagious. It cannot be passed person to person. It cannot be contracted from drinking water. So I think these are important messages to reinforce with the public. The other message to the public, of course, is anyone who has concerns about symptoms and the general symptoms of Legionnaires' disease would be headache, a cough, fever, muscle pain. Anybody with symptoms that are causing concern is advised to contact their GP or NHS 24. NHS 24 has established a special advice line for those concerned about Legionnaires' disease, which has just gone live. The number for that is 08000 858 531. NHS Lothian has prepared an information leaflet which will, over the course of today and into tomorrow, be sent electronically to all community contacts in the area and door to door to give people the advice and the reassurance that they need. Lastly, in terms of next steps, as I said at the outset, the Resilience Committee will meet again this evening to update on progress around all of the things that I've been talking about. I will update Parliament in a statement tomorrow morning, and we will keep you all as updated as we possibly can on all aspects of information as we have it.